Hello everyone, I am Dr. John Helmaggi, owner and founder of today's Headache and Facial Pain Institute, formerly known as the Michigan TMJ Headache Institute. One of the most common questions that we get are, how do you diagnose where my headaches and migraines are coming from? How about my jaw pain, facial pain, ear pain, dizziness, vertigo? Before you watch this video, please make sure that you have reviewed our videos in the playlists, What Causes Head Pain and How to Properly Diagnose on our YouTube channel so that you can learn more about anatomy and causes of head pain. In this video, we are going to cover one of the most important and key aspects of diagnosis. This video is an update on the previously mentioned proper diagnostic methods video, and we are going to go more into details about the TM joint and its anatomy so that you can see how this critical part of your head anatomy can influence so many aspects of your head. Currently, we use mainly CT scans of the joint area to help us make the proper diagnosis, and that is the purpose of this video. Please realize that it is important to determine what a patient needs based on evaluating the TMJs as well as the muscular and skeletal problems. Proper diagnosis of head pain issues can only be made through a comprehensive examination and CT scans of the TM joints. It is also important to differentiate between stress, muscles, and/or joint problems. For the majority of our patients who clench and grind their teeth, it is crucial to be able to see if they actually have damaged their joints or if their problem is due to stress or anxiety-related grinding and clenching. Only a CT scan can help us to make this distinction and determination for a proper diagnosis. MRIs can also be helpful. So let's review a somewhat normal TM joint. CT scans give us the ability to see the joints from all sides, top, front, and side, as well as 360-degree view around the joint. What we are looking for are the following. A normal joint will be characterized by adequate thickness of cartilage, shown here. You will see an approximate space of 5 millimeters. This is represented by the dark color separating the top of the condyle, top part of the lower jawbone. This 5 millimeter of tissue space has to be seen around the entire joint for it to be considered a normal joint. This is similar to a moat around an old castle. Any loss of space is considered abnormal. The cartilage protects your brain, which is seen here, with help from a healthy articular surface of skull bone. This is your articular surface, this is your skull bone that protects your brain tissue from the condyle of the lower jaw. Although this scan shows a fairly normal joint anatomy, this patient can still exhibit sporadic migraines due to what you can see here being a thin skull bone. If she develops severe clenching or grinding problems, she can experience headaches as the lower jaw will be hammering this area of the brain. This can happen despite having a normal joint. Every time you bite or clench, which can happen at least 7,000 times per day, you are placing over 50 pounds of stress on this area. That equals to about 3,500 pounds of pressure on your brain every day. an F-250 truck sitting on your brain all day long. This is why migraine sufferers feel like they have their heads stuck in a vice. Ear structures are intimately related to the joint. This is your ear seen from the side view. There's a semilunar canal that shares blood flow and lymph flow between the joint and the ear structures. Any damage to this joint can cause changes in normal blood flow of this area, and that is why patients can develop ear problems, including pain and vertigo. A 360-degree view around the joint is always completed because sometimes you can only see damage in remote areas such as on the inside or outside of the joint. In this case, we can see some slight compression of the internal joint. Now, let's take a look at a diseased jaw joint in a patient with multiple symptoms. In this joint, you can see quite a difference in the way the condyle and the way that the joint areas look. It's almost as though a grenade went off in this joint. There's severe degeneration, sclerosis, and overall breakdown. This is the typical patient who suffers with severe migraines, headaches, jaw pain, tinnitus, and dizziness. As you can see, this scan shows a joint with chronic degeneration and very little cartilage remaining. The 5 mm space in this area is no longer seen, and this patient has well over 80% damage to the joint. The trigeminal nerve branches, which provide mainly sensory innervation to your forehead, eyes, sinuses, ears, palate, nose, teeth, tongue, cheeks, lip, and throat areas, have to travel through or near this joint. Now you can see why damage and compression in this area can cause a wide range of symptoms, from visual problems to throat pain and even increase in heart rate. The trigeminal nerve is the most complex nerve in your body. The facial nerve, which provides function to your muscles, also resides close to this area and can also suffer from compression problems, leading to such diagnosis as Bell's palsy. Once we see such damage, the only options of treatment have to be aimed at decompressing the joint and allowing it to try to heal with some fibrous tissue. Once cartilage is gone, it will not regenerate, but unlike other joints in your body, we actually have the advantage of being able to use your teeth to provide stability and joint relief by using various orthotics similar to a cast for a broken leg. This allows the joint to heal and function with the damaged cartilage while reducing pain symptoms. We basically immobilize the joint so that it stays in the correct position and the nerves and arteries can work normally again. Many chronic pain patients have worn out their joints and cartilage, and they may not even know that this has happened. This is often a slow process that does not get detected clinically. In some patients, joint sounds such as popping and clicking are heard, but in others, the joints appear normal. This is seen in joints where the bones have smoothed themselves off without degeneration and they make no clinical sounds. Such joints are seen in the next CT scan. In this particular patient who came to our office, there were no clinical signs of popping, clicking, crepitus, or any other joint problems. The CT scan shows severe compression and loss of cartilage in most of the joint. However, the patient exhibited no other symptoms. As you can see, in some areas, there is bone-on-bone relationship. But if you also look closely, it looks like a popsicle where the bones here look like ice skating rings. This patient's bones have been dealing with this damage for a long time, so more calcium has been deposited in these areas, and the body is trying to protect the brain from further damage by toughening up the bones. And even though this patient is opening and closing with no sounds, she's basically skating bone on bone here. Now, excuse me. Now we also get a lot of inquiries from patients who have had CT or MRI studies, which have concluded that their joints are normal, and none of their doctors suspected that they have a TMJ problem because there are no joint noises or pain. As you've seen in the CT scan, that is the reason why this happens. In such cases, we also question the quality of the CT or MRI study, simply due to the fact that many times we find that the patient was not even asked to bite down during the study. This leads to false negatives, as the joints will obviously not be in the right position when the patient is biting. If in fact we do find that the scans were done properly and the joints are normal, then of course we focus on simpler treatments of muscle dysfunction and protocols to treat the pain from a non-skeletal perspective. This is usually done by changing the type of orthotics that we use and the type of treatment that we recommend. Finally, if you review the information on our website, including many of the anatomy photos that you will find throughout our website, you will come to understand how a compressed and diseased jaw joint can have such far-ranging effects on your head. Many of these photos are a good reason to review the information. Diseased joints can have far-ranging effects on your head. If you look at the nerves that exit the TMJ area and branch themselves out throughout the entire head and face area, as you can see how these nerves exit the TMJ area in the back of the jaw, you can see how they innervate your entire head and how the effects of compression here can be so wide-ranging. If you review the anatomy of the carotid artery, you will see how a Hoover Dam effect of a compressed jaw joint can decrease blood flow to the brain and the structures of your head. Furthermore, looking at your 12 cranial nerve distribution, you can see how closely they neighbor the TMJ and the back of the jaw. A dissection of the neck area and nerve distribution can easily be seen, and you can realize how it can be affected by compression in this area. The trigeminal and corresponding facial nerves have many branches that control over 45% of the function of your head, including the blood flow to the brain. As you can see here, the trigeminal nerve has many branches of sensory innervation, and that is why patients can have so many pain issues. The trigeminal nerve is also the nucleus that provides stimulation to the blood flow and actually controls many of the functions of your brain. In the 30 years that we have been treating head pain patients, we have always been able to determine where pain comes from and what the best treatment options are. This includes all forms of migraines and headaches. If you have any more questions, please feel free to contact us, and don't forget to read all of the material on our website for more education.